I have one question. I'd really appreciate as short an answer as you can provide. And it really gets to what I was trying to get across in the opening statement, and that is for all health professionals, including first responders, all health responders. What we need to do is to better educate, better prepare, better train, give the proper skills to our actual and potential responders. So what I'd like to hear from each of you very succinctly in your perspective, is there a skill, a knowledge, or set that we need to accentuate with our responders from your perspective that they're deficient in at the moment? And with that, I'll start with Dr. Cordero.
Jim, thank you for the question. And what I would say is that it's really important for responders to understand the community and understand what are the underlying challenges the community has. And I think that going back to the example I gave of transportation, often that's not something that is planned or considered necessarily preparedness. And it's just be able to connect what the challenges are that this community has with the preparedness or the responders' ability. But I would say know the community.
Excellent, thank you. And next, why don't we go to Dr. Igawa?
Thank you very much. And I think that COVID-19 brought us the sense of necessity for the every practitioner's health workforce to understand the health emergency concept and the disaster risk management. So this is a kind of practice for the general health practitioners to understand the importance of the health risk management, our health emergency and disaster risk management practice. And I don't think every Japanese medical schools are teaching their students so seriously about the disaster medicine. But as I showed in the correlation between the life expectancy and the disaster risk, the improvement of the universal health coverage or general health provider will decrease the social determinants of the health risks, resulting in the less risks in the disaster response. So I think that is not the confronting matters. That is the coordinated matters. Thank you.
Thank you. And I just want to make one comment. We've received some excellent input at the journal in terms of a couple of studies trying to look at the status of disaster medicine education. And again, when I talk about that, I include preparedness, public health, and the whole system to include obviously climate change and its impacts. But when these assessments were done basically in medical and nursing schools, only about 20–25% of undergraduate curriculum adequately addresses these areas. So in spite of everything that's gone on since 9/11 and all of the other disasters, we're woefully deficient, at least from the perspective of those studies going forward. So thank you, Sunichi. And Asha, if you have something to add here.
Yes, I think for disaster responders, first responders specifically out in the field, working without power is how to deliver healthcare in those settings is very important, as well as understanding just oxygen and hooking them up. And I found that that's something that when I'm responding, I'm always teaching. And I think if we can give everybody a basic understanding of that, what the regulators do, how safety issues around that will go a long way for the future. Over.
Right. Good observation. Thank you. Jason?
Thank you. I think for me, the skill that's being underemphasized is a soft skill. Like Dr. Cordero mentioned, you have to know the population you're going to be aiding. And the best way to know that population is to actually listen. I know for me, when I'm going into a response, it's very tempting for me to go on autopilot and think that every MI is the same, every head trauma is the same, every release is the same. But each patient is going to have a different outcome, and the patients, more likely than not, the patients are going to be your best source of information as to the circumstances of the disaster. So being able to actually listen in the heat of the moment is an exceptionally important skill.
Wonderful. Thank you. I think those were excellent observations and make for good input going forward as we design our programs and we try to influence educational programs.